Is conductive hearing loss a cause of ringing in the ears? Imagine feeling like your ears are blocked or full and suddenly hearing a ringing or buzzing sound that no one else can hear. That's what some people experience with tinnitus, and it can be linked to conductive hearing loss. Conductive hearing loss happens when sound can't travel properly through the outer or middle ear. This can happen for many reasons, like earwax buildup, middle ear infections, fluid behind the eardrum, a perforated eardrum, or abnormal bone growth such as otosclerosis. These issues block or reduce sound transmission, making sounds seem quieter or muffled. When sound doesn't reach the inner ear normally, the brain can sometimes interpret this lack of input as phantom sounds like ringing or buzzing. This is why tinnitus often occurs alongside conductive hearing loss. Although tinnitus is more commonly associated with sensorineural hearing loss, which involves damage to the inner ear or auditory nerve, it can also happen with conductive issues. The abnormal sound conduction can affect how the brain processes sound, leading to perceptions of ringing or humming even when the outer or middle ear problems are present. In some rare cases, if the tinnitus is pulsatile, meaning it pulses in time with the heartbeat, it might be caused by vascular issues like abnormal blood flow in nearby vessels. These situations requiring specific medical evaluation to identify and treat the underlying cause, which can sometimes resolve both the hearing loss and the tinnitus. Treating the root cause of conductive hearing loss often helps reduce or eliminate tinnitus symptoms. For example, removing earwax, treating infections, or repairing a perforated eardrum can restore normal sound conduction. When the conductive issue is addressed, the abnormal auditory signals that cause tinnitus often improve or disappear. It's important to see a healthcare professional for a thorough evaluation if you experience ringing in your ears along with hearing difficulties. They can determine whether your tinnitus is related to conductive hearing loss and recommend appropriate treatment options. In summary, yes, conductive hearing loss can be a cause of ringing in the ears. The disruption in sound transmission through the outer or middle ear can lead to phantom sounds, and addressing the underlying problem is often the best way to manage tinnitus. Always consult a healthcare provider to get an accurate diagnosis and personalized treatment plan.